Hi, and welcome to the show. Subscribe at kevinmd.com/podcast to get CME for this episode by clicking on the CME link in the show notes. Today, we welcome JC Gonzalez. He is a health equity researcher and advocate. His KevinMD article is titled, How Data and Technology Influence Health in Ways That Doctors Don't. JC, welcome to the show.
Thank you so much for having me.
We'll get into your article in a little bit. First off, briefly share your story and journey to where you are today.
Well, my name is JC Gonzalez. I'm a health equity researcher, as you said. I've been focused on understanding the development and expansion of data and technology that address health inequities. I have over 15 years of experience in healthcare, first as a clinical systems designer and project manager, more recently working in strategic planning for the Institute of Global Health Equity at Meharry Medical College. My research has focused on understanding how technology and data contribute to our strategies and interventions that deepen our understanding of the root drivers of health.
All right. So you talk more about that in your KevinMD article, and we'll dive deeper how data and technology influence health in ways that doctors don't. So how did this article come together?
Well, with this article, I wanted to address the impact of health technology and integrated applications on patient care and highlight the potential gaps and biases that can arise from that. Through research and drawing from real-world examples, I aim to shed light on the importance of equitable decision-making, the importance of representative data collection, and really explore the collaboration between clinical and technical teams during technical development when these systems are designed.
All right. So go more into that.
What we've seen really in the last 3 years or so is an industry that has not been historically deep on technical innovation. And with that, I mean healthcare. And the industry's been thrust into a widespread adoption of technologies that simply didn't exist a few short years ago. So I wanted to explore the rapid pace of this innovation, what that means for the growing role of technologists. What we've seen, early in the pandemic, the last few years, is really the expanded role technologists have in the clinical and patient care experience. It's really starting to see where those decisions are made and who's making them.
So when you talk about technology and innovation, what specifically are you talking about from the patient standpoint?
So, drawing from my own experience and what we've worked on is the design of something as simple as the telehealth app that a lot of people use on their phones. There's really a lot of technical decisions that are made on how that should function, the workflow and data flow. And when you think of it, there's really two perspectives. There's the technology, how it should work, but then there's also the patient experience of how does that promote engagement for the patient to lessen kind of the burden and barriers so they could adopt that technology effectively. And ultimately, I think most people involved in technology, their goal is to have the technology disappear so the doctors and care providers could interact with the patient and not be struggling with the technology.
So one of your specialties is that intersection between equity and technology. So specific to these telehealth platforms, what are some disparities that arise from the implementation of this?
That's a great question and it's an important one. And I think of my mom a lot, who's someone that struggles with technology. And we see in the literature now the growing digital divide is a term that you see more often now. And it's just thinking about this rapid pace of invention, really, and how these things are developed and put out there. There's some people that just either don't know how to use it. Maybe they don't have digital literacy for it. Maybe they have mistrust. They don't understand how their data is collected and will be used. Or there's just a training component for the clinical side of things. So really thinking about not only getting these solutions out there, which are important, but in thinking about the training aspect of it, the adoption aspect, and addressing those kind of disparities and why some people use them effectively and others don't. We want to make sure that no one's left behind.
So tell us your ideal world. So if you were in charge, how would you implement this to reduce some of these disparities?
Well, the important part really is thinking about the importance of collaboration and interdisciplinary teamwork. I mentioned earlier non-clinical teams, and we're talking about technical designers and data scientists. They're really emerging into the patient care experience in a way that we haven't seen before. So I would caution clinicians, especially physicians and other providers, to be thoughtful of who are the decision makers during development and ensure that we follow those technical kind of considerations downstream into the patient care experience. We want to leverage, the unique experience from everyone,
Mhm.
including non-clinicians, but ensure that ultimately the patient care experience is followed all the way through.
So you mentioned telehealth as one platform that patients often interact with from a technological standpoint. What are other examples? What are some other ways that technology influences a patient's health experience?
It's huge, and the big area of focus that I've had is really representation in data. So we know today that health systems, insurers, different stakeholders, and not just direct care providers, are generating huge amounts of data.
Yeah.
We've seen the rise of AI and machine learning leverage this data. So when you think about the way that data influences our healthcare, when policy decisions are made, resource allocation decisions are made, you want to make sure that we have a very good, strong understanding of how that data is collected, who's represented in that data, and ultimately is leading to data-driven decision making from all aspects and all stakeholders. So it's a big and growing field just because of the volume of data that's generated every day. But there's core representation and transparency kind of concerns around how that data is used.
Give us a story or a case study of how you feel this data is being, misrepresented or not being used to the best of its capability.
I have a great example, and let me know if I don't want to name names, but
Yeah, of
we
course.
in my previous role as product manager for the health equity tracker, it's a data platform we developed to really think about lessening the barriers to data, and ultimately more people could use the data, whether it's a personal decision or maybe it's an organization. So one example that I really love to use in the past is we use a data set for COVID case counts and hospitalizations and deaths. It comes from the CDC, and one core challenge we found was the way race and ethnicity is encoded in the data set. So very briefly, and I'll oversimplify for the sake of time, but if I was in the data set and I recorded myself as white Hispanic, white is my race, Hispanic is my ethnicity, due to the way the data structure was encoded, it was only able to capture Hispanic. So in the data set, I would be represented as Hispanic only. And this opposite is true as well. So some people identified as maybe Black Hispanic, or maybe they lost the demographic detail of their race being Black. So what that does at a broader scale, it adjusts our perceived impact to populations. You're either overcounting or undercounting impact. And we know, especially for some of these marginalized groups, the impact is huge. And if you're not really representing the data in a really accurate and representative way, decisions are made understating those impacts. So I hope that was the answer to your question, but that's a very simple way of how data could maybe not be as representative as we strive for.
So when you say some of these decisions are being made based on data that isn't being coded correctly, what would be an example of such a decision?
So now one that was completely a technical constraint, and the decision at the time was to capture one or the other. And the technical decision later on, I was happy to see that they were able to fix it after. And what they did is broke it out into separate categories. So now you get the fidelity of race and ethnicity,
Mhm.
not one or the other. So it's a good example of not a clinical decision, not a patient-driven decision. It was purely a technical design decision that grew downstream, and you could see and follow that down to see how that is represented.
So, to my clinician audience, I'm a primary care internal medicine physician. What are some things that we can do to kind of help this data disparity, this health inequity as it relates to the data? Anything that individual clinicians can do?
Absolutely. I would say, I think I spoke to this earlier, is being partners with these new kind of technology focused roles, understanding that it's our responsibility to advocate for inclusive design. When we think about data collection, advocate for representative data, expand on kind of your understanding and advocacy for your own training and knowledge to understand how is data collected, what kind of definitions are included in a data set. And that could expand to technology as well. So understanding how a system is designed and functions. And really, I think it's the role of the clinician to really advocate for the patient care experience to ensure that whatever is developed, that is not a afterthought, that really the patient engagement and design decisions that could expand on inclusivity, promote engagement, promote representation, that make sure that those decisions are discussed frequently and often and early in development.
We're talking to JC Gonzalez. He is a health equity researcher and advocate. His KevinMD article is titled How Data and Technology Influence Health in Ways That Doctors Don't. JC, you mentioned the influence of artificial intelligence as it relates to health technology innovation. That's certainly a big topic now. How do you see the role of AI now and going forward?
There's tremendous interest in thinking about AI and language models and how that could be used in healthcare. Really, we've seen, the tremendous pace of innovation. We really don't know where that's headed. The potential is exciting. From my role as a health equity researcher, we want to just make sure that these systems are programmed in a way that discourages bias, that it is not proliferating bad data. And we really train these programs and models in a really kind of thoughtful, inclusive way that doesn't spread the lack of understanding of how it works and how it's trained. From my background in technology, we typically don't get a lot of access to the training of these kind of artificial intelligence and language models. So advocating for transparency of how these things are programmed and it could be an important thing to consider.
And my final question, tell us some of your take-home messages that you want to leave with the KevinMD audience.
I hope the take-home message again is we all have a role in this rapid pace of development and exciting times that we are experiencing in healthcare. Like I said, I think we haven't seen anything like this in healthcare innovation. And so being a partner with these different roles that are emerging, advocating for the values that we know leads to good healthcare, the things that patients value, and I'll speak on my own behalf as a patient, is technology that encourages engagement with providers, that makes me feel represented and accurate to my own experience. And that doesn't happen by accident. That takes an active kind of decision point from someone, whether it's a technology decision, a business decision, or a clinical decision. So really kind of advocating and partnering with these teams, looking for the strengths from each role. It really is an exciting time for healthcare, especially when you think about where the technology is headed. I think we all have a role to ensure that it's an equitable decision and adoption.
JC, thank you so much for sharing your time and insight. Thanks again for being on the show.
Thank you so much. Thank you for having me.